and welcome to the podcast of Loughborough University's Institute of Advanced Studies, a podcast where our international fellows discuss the most pressing issues of today that we're all facing and share their exciting research ideas. We hope you enjoy today's talk. Thank you for tuning in.
So it's our last day of the Business of Women's Health event on campus. We've had a very busy week so far with lots going on last week. Lots of innovation workshops happening, which was brilliant. Some rugby over the weekend, and we've had some fantastic spotlights so far as part of the IAS support around this too. So we're finishing off today. We've got a session this morning with Deirdre, who's going to introduce us to a lot of her breast health and bra research. And then we've got some sessions later today, which we'll run you through as well. Alongside that, there are a few things just on exhibit around campus, around this theme, and we've also got a few posters up and a few things up in the tea room next door as well. And that being said, if anyone does want a drink or a snack at any point or needs a loo, feel free to head out at each time. We'll leave the door open just to help with a bit of airflow here as well, because it can get a little bit warm. Some of the things that we're going to be engaging with and following up with from this event is an innovation roadmap. So the last session today, 3:30 to 4:30, Verity is going to be taking us through that. So that's kind of bringing together a lot of thoughts that we've had around the Business of Women's Health Summit and some of the outcomes and future directions that will be taking. We've also got a podcast series that has got a few episodes live already, and I think we've got a few more still to come out across different themes, which has been fantastic. So definitely give those a listen. We've had we're at the end of our summit really, and we've had a lot of games going alongside this as well. So it's been a busy week, but really there's a lot more to come on this as well. So upcoming events that align to this, we've obviously got our IAS days yesterday and today, so we've still got a couple of sessions later, afternoon tea and the innovation roadmap session that you can sign up to or stick around. We've also got a public lecture that will be taking place in NCSEM on medical equity in the women's game. That will be Dr. Karen Jones from the RFU that will be doing that on the 24th of September. So we can send these links out afterwards as well, but that would be great to attend if anyone's interested on that too. So other things more externally now, although some of them will be at Loughborough, we've got the Global Observatory for Gender Equality in Sport. I think that's is that conference happening? I'm looking at Verity for this one. Later on this year, the IWG Global Summit and WISAN 2026 as well. So we'll be hosting that next summer. And obviously we've got our Loughborough Lightning fixtures as well, which have been very well attended so far and will be into the next year. So before I pass over to Amy to give us a bit of an introduction to Whisper and then on to Deirdre, we've just got a lot of thank yous for the last few days. So a lot of the people that really brought this together and helped make it happen, but in particular, a very big thank you to the IAS team that have really helped with this spotlight session, helping us to get all of our fellows over here. It's been a really fantastic couple of days.
Perfect. Thank you. So hi everyone, so I'm Amy Mears and I'm a senior lecturer in the Sports Technology Institute, and welcome to those joining us online from the ISEA, which is the International Sports Engineering Association. And I just wanted to share with you today a network that we're trying to set up as part of ISEA. And it's all off the back of some research we did back last year, looking at sports engineering research and the representation of women in sports engineering research. And we know that from the sports science field that women do tend to be underrepresented. And, you know, we see similar themes in terms of the sports engineering research as well. So this is some data that was pulled from this perspective article that's published in the Journal of Sports Engineering, where again, you know, we do see quite small numbers in terms of the number of female participants in sports engineering research. And as part of that, we hosted the ISEA conference last year at Loughborough University and saw it as an opportunity to bring researchers together to try and understand, again, is there a need to try and elevate the number of women who are researching sports engineering for women's needs in terms of the products that we're working on and some of the key themes that need to be addressed. So at that conference, the Whisper Network was born, which is Women in Sports Products Engineering Research Network. And the aim is really to or is due to the importance of sports products in enhancing performance, safety and enjoyment of women in sport, exercise or physical activity. So really the vision is to create a global community of researchers, engineers and industry partners, policymakers and users who are committed to advancing sports project engineering and design for women. So it's in its infancy, it's just kind of, we're trying to bring it together at the moment. So there's a team of us from both Loughborough and the States, with both industry and academic backgrounds. So if anyone's interested in finding out more about the Whisper Network, and obviously those online as well, then please feel free to contact any of us, and we'll certainly be starting to kind of share some more insights about the network as we go forwards. But I think it ties in really nicely with what Deirdre will present to us today, and all the work that's done in terms of sports bra design and engineering of sports bras.
Thank you. Did you want to?
Oh, and yes, sorry, one final thing. If anyone is interested in publishing in this space, then I'm leading a topical collection again in the Sports Engineering Journal, which is the journal of the ISEA. Then we are welcoming submissions. Obviously the topic is inclusive sports engineering and technology. But again, if you've got some research you'd be interested in publishing, then again, feel free to reach out to myself or any of the guest editors, and we'll be happy to let you know whether we think it's a good fit for the journal. But certainly welcoming any research in that space.
Thank you, Amy. So we're going to move on to our main session today. So we've got Professor Deirdre McGee joining us all the way from the University of Wollongong in Australia as the Director of Breast Research Australia. So today she's going to take us through a presentation called Design to Adapt, Breast Health Innovation and Return to Movement for Women. So if I can invite Deirdre up. And just a quick bit of housekeeping before Deirdre begins. So we're going to have our presentation. We'll open for discussion, questions, but we are going to prioritise our online audience initially for those questions, just because there is a limited amount of time that they can join us. As I mentioned, we have got an afternoon tea session later today, 2 till 3. So if there's anyone else that has any other questions at that point and we run out of time this morning, they can come back then to ask Deirdre those as well. So over to you.
Thank you. Well, I'd like to thank the University of Loughborough and the IAS for bringing me over here. I've had a fantastic time, and it's really broadened my understanding of definitely of organisation of sporting events. So thank you very much. So my topic today I'm going to talk about is what we want to be trying to do ultimately. The end game is that we keep females active for life, and that we promote female athletes. We want to be like a female athlete. We want our young girls to be aspiring to be female athletes, not male athletes. So we want to play like a woman and be proud to play like a woman. Because we face challenges that men don't face. And often in rising above, that's what we should be aspiring our young athletes to try and achieve. So when we look at the challenges that a female athlete or a woman being active has, they're unique to men. So we've got issues that we've got to try and overcome to promote physical activity and athletic performance. So we go, as researchers, we can be part of the support system to address those issues, to assist and promote females to be physically active and reach their peak performance. So breast-related issues are just one of many barriers or many challenges that females face. So that's what I'm going to be talking about today, but remembering that they're part of a big picture. And so we have to make sure that when we're looking after them in sport, that we're time efficient and we manage everything that a female athlete has to face. So being active for life, how do we prevent young girls from pulling out of sport? So we know that children, male and female children, are pretty equivalent in their physical activity, but females drop off at puberty, and then at adulthood at 18, women drop off again, and then they drop off again after pregnancy and postpartum. So we know we have these slumps. So how can we keep women to be active? By promoting that childhood activity to continue, by promoting women to continue physical activity and resume sport postpartum, and then promoting physical activity during pregnancy. So that whole perinatal period, that we support female athletes to maximise their performance by optimising their breast health, and that we promote and support physical activity after menopause so that women don't drop off again. So I'm going to be looking at these breast-related barriers to physical activity and athletic performance that have consumed my life for nearly 25 years, right? So that's been my focus. So I'm going to talk about what we know, what we've learned from the research we've done so far, and then as we hand the baton on to the next generation to continue, what's a bit of an action plan of aspects that would be useful to research. So first I'm going to talk about breast pain, then I'll talk about breast biomechanics throughout the lifespan, I'll talk about breast support, which is really sports bra design and fit, and then I'll talk about breast injuries. So in terms of breast pain, there's 4 types of breast pain that women experience. So we've got pain related to movement. So when the breasts move up and down, and we've measured it mainly during running, and we call this movement, which is like this, breast bounce, because it looks like they bounce up and down. And we know for women with larger breasts in particular, that causes breast discomfort. And that's bilateral breast pain, and it occurs when they move. So it's pretty easy to diagnose. Then we have pain that's associated with the menstrual cycle. Most commonly, a couple of days before the period, that women will have tenderness and sensation of swelling in their breasts. The breasts can actually increase in size, and that's related to hormones. They can also have it around ovulation, but it's more commonly around that menstrual period. And then once the period comes, then the pain resolves. But we know this pain is made worse with physical activity. So you can't dictate, unless you're taking the pill, that when that period is going to occur relative to competition. So that cyclic nostalgia could be occurring at a key time in your competition phase, that can actually negatively affect your performance as well. Then there's non-cyclic nostalgia, which means breast pain that's normally unilateral pain. These are commonly bilateral breast pain. So non-cyclic nostalgia could be related to an injury, could be related to an infection in the breast or some trauma to the breast. And then there's extramammary nostalgia, which is pain that's referred to the breast, but it's actually a problem in the trunk. And that's got to do with the innervation of the breast. Most of the pain we talk about with affecting athletes, we're talking about exercise-induced breast pain and cyclic nostalgia. And you can see there's decent percentages of athletes, this is more athlete data, that are experiencing these problems. And when we look about breast movement, we have to think about how much breasts move during sport. So during an hour of running, the breast will bounce about 10,000 times. So women are often shocked about how much breast movement is involved in running. And that's because every time your heel hits the ground, your breast bounce. And we've measured that breast movement, and this is a bare-breasted, which, there won't be many women who are actually exercising bare-breasted, but bare-breasted, that upward movement to the downward movement has been measured up to 17 centimetres. So that's a massive amount of movement that can occur. In terms of cyclic nostalgia, there's a lot of lifestyle and medication assistance that can be given to women to help them manage that pain. And we want to manage both of these pains, particularly in our athletes, because we know that a third report that these pains negatively affect their performance. And we know we can help them quite easily. They're easily alleviated or resolved by just improving breast support. So it's almost, a shame on sport that these are a problem, because we can actually quite easily do something about them. But most athletes silently suffer these. They don't talk about them. So women don't talk about their breast-related issues. And there's multiple reasons why women don't do that. So we actually have to open up the conversation to enable athletes to speak about these issues and then manage them, right? So we can actually fix them. So in terms of an action plan, there's enough data on breast movement now, and there's enough data that sports bras and correct bra fit are effective to alleviate them, that we're on to dissemination. We're really on implementations phase of this research. So we need to work out, how are we going to get this information to the masses about sports bra design and bra fit? And we need to realise in multiple sports the difference between curriculum versus dissemination or teaching. So we've got each sport wanting to write their own curriculum on breast support and bra fit. And what we've done in Australia through the Sports Bra app and through the Female Performance Health Initiative, we have written curriculum. We had, spent a hell of a lot of time and evidence-based data to develop this curriculum, and it's freely accessible. So we are recommending that sports, instead of repeating and developing their own labelled curriculum, refer to other curriculum and put resources into dissemination, into teaching athletes about this. But we also need some type of surveillance. But does that surveillance need to be all the time? So athletes are getting exhausted by wellness initiatives to collect so much data about athletes. So I think we need to look at the difference between health versus injuries. And when we talk about breast pain, that is a breast health issue, and that health can affect performance. So that's not an injury, that's a health issue, along with menstruation, pelvic floor, body image. So they're all health topics. So I think we need to be smart about how much we collect this data in our athletes. To collect it all the time, it can actually turn athletes off from actually bothering to report. So I think that's something we need to think about in terms of data overload. In terms of research, I think there's still research in this space, and there's a recent article that was produced in Australia looking at hormonal fluctuations for cyclic nostalgic pain to understand that pain better. In terms of exercise-induced breast pain, we actually don't know the tissue that's causing the pain. We presume it's due to tension on the fibrous tissue within the breast and the perimeter of the breast. We presume that, but we actually don't know it. So understanding the extent of tissue damage or strain, I never talk about tissue damage because there's no evidence for it. So I go, don't start promoting things if you don't have evidence for it as a researcher. But definitely there is that being discussed by other researchers and definitely by other bra companies and putting fear into women. So I think we need to sell the benefits of wearing a high support bra, of how it benefits performance, and don't scare women about they're doing trauma to their breast. So we're doing this to promote your performance and promote your comfort, but don't talk about damage unless we know that. So, should we be investigating, looking at what's actually happening to the tissue? And as engineers, maybe that's, your pathway. Physical measures of performance really haven't been measured, so I think the breast support and bra fit or changing someone's breast pain, it's not going to make huge differences to performance. It's a 1%er. Should we be measuring performance in these women? So what we've got is perceived effect on performance, not actual physical performance measures. Will that help the cause? Will that hinder the cause? I only sell it as a 1%er. I go, it's just one other facet that we want to do to peak your performance. But in terms of barriers to physical activity, I think it's definitely a barrier. There's no question breast pain's a barrier to physical activity. But also, we don't have enough data about different populations. Do different cultures, do different age groups, do different races, do they have different experience of breast pain? So we're looking generally among women, and as was really discussed this weekend, a lot of data on white women, instead of looking at different cultures and do they have different experiences of breast pain. So I think, carry on. There's a lot more work that needs to be done in this space. In terms of breast anatomy, I think, hats off to us. Breast Research Australia, we really led the way with this first dissection research to actually look at the structure of the breast and explain what Cooper's ligaments are. Everyone was talking about Cooper's ligaments and no one really understood what they were, and me included, and hence why we did this research. But this is Cooper's ligaments. This is what it looks like. So you'll see these drawings of fine threads, and yes, it's a fibrous mass. It's a three-dimensional cobweb that then the fatty tissue of the breast is then encased in. And then the glandular tissue of the breast penetrates the breast through the nipple and then spreads out throughout the breast, buried within that fibroadipose mound to protect that delicate glandular tissue. The breast is adhered, and look how strong that perimeter is. So that fibrous perimeter of the breast grips and holds on the breast to the muscles of the anterior lateral chest wall. So here we have pec major, and then here's serratus anterior, external oblique, rectus abdominis here, pec minor tucked into pec major here. So about 75% is pec major, and then we have serratus anterior on the side and pec minor on the side, and then your abdominal wall. inferiorly. So it's held firmly to those muscles. That's where it's attached to, not the posterior wall. The posterior wall, you could put your hand on a cadaver and you could just scoop the breast out just with your hand, just blunt dissection. But that fibrous fibrin you have to cut. What that means is that those muscles will hold onto your breast. And what we see when we get women to run who have insufficient breast support is they brace. So they hold onto their breast with these muscles. And that's happening here. I go, you can't stop that. That's your brain. It's like joint stability, where you inherently will waste muscle torque to stabilize an unstable joint. You'll do the same thing for your breast. So if your bra isn't supporting your breast enough, you will use muscles, your muscles of your upper limb, so pecs, serratus, major muscles that move your shoulder girdle. You're going to use that to hold your breast still, rather than your bra doing that and you use your arms for your support. We've scanned hundreds and hundreds and hundreds of women's breasts and taken, you can see how we've, take the perimeter of the breast out to measure the breast volume and looked at the forces that the breast place on the thoracic cage and measured that flexion torque. So we know that the breasts create a flexion torque. The larger the breast, of course, the larger that flexion torque on the thoracic spine. And then we've measured what effect it has with movement. And I'm not sure how I get this wrong. Maybe I didn't. And you look at what the breasts look like when they move. This is what we call breast bounce. And the breasts look like liquid, This woman, this is a high support encapsulation sports bra, and she was professionally fitted to wear this bra. It's too small, of course. But you can see how much they move and bounce, and that's movement of the breast relative to the trunk. So the trunk stops, trunk comes down, heel strike hits, and then the breasts come down. And the bigger, we call that breast slap, because it appears like they slap against the chest wall. And the larger the breast, the greater that slap. And it's because there's a lag between when the breast hits its low point and the trunk hits its low point. Trunk hits first with the heel, and then the breast slaps down. But the other thing you should see is that the breasts move up and down. And so that's why you need a bra to cover all of your breasts, because you want to stop the upward movement as well as the downward movement. Because the downward movement in Lauren research, she really showed how much force was really happening in that lower part of the breast at that low point of the movement. Let me hang on this one now. Here we go. And then we've looked at what effect that has on the upper torso. And so if you have your upper torso more flexed, and everyone do that here now, like if you just curve your upper thoracic spine, you'll see that your shoulders will go into protraction, your scapulars have moved away from the midline, and your glenohumeral joints will go into internal rotation. I want you to hold that position, and then I want you to lift your arms up, raise your arms as high as you can, but you've got to hold the kyphosis. Hold the kyphosis, and the kyphosis here, cave in here, cave in there. Put your arms down and cave, and now lift as high as you can, and you can't. Okay, so it affects shoulder range of motion, because the thoracic spine has to extend for the glenohumeral joint to have full range. Like it's anatomy, right? Basic anatomy. So we know that when we change the posture of the thoracic spine, will really affect the shoulder, but we're also going to affect the neck, because the neck's going to change position, and then we're going to affect the pelvis. And if you affect the posture of the pelvis, then you affect the lower limb. So there's this chain effect going on where we know that will affect shoulder range of motion and will affect scapulohumeral rhythm. So we'll put the shoulder more at risk of injury, particularly if there's above head activities. Think about your volleyballers, your basketballers, your netballers, anyone who's doing above work here, tennis players. And we know that will affect the strength of those muscles around your upper torso, and particularly the muscles that the breast attaches to. And we know that definitely with larger breasts, it's really associated with upper torso pain because of that change in posture. The biomechanics of the upper torso is non-optimal. And we also know from changing the thoracic cage, you change the pelvis, and you change the pelvis and you change the lower limb. So we've got this carry-on effect in terms of landing mechanics and running efficiency. And we know that if we elevate the breasts by putting them in a high support bra, we can seriously improve this. So again, no brainer. We need, particularly in women with large breasts, they need to be wearing high support bras to optimise their posture. And if a physio is treating a patient, a female patient, who comes in with thoracic, shoulder or cervical pain and doesn't look at their bra, they're negligent in my mind. Right? Not good enough, do better, you know. We've also looked at the structure of the breast throughout the lifespan, and we've looked at how breasts change during adolescence because of an increase in breast mound. The good thing about adolescence is their skin is so good and collagen so good, so they've got more anatomical breast support. So the anatomical breast supports are the overlying skin, the fascia within the breast, and that collagen, the quality of the collagen that holds the breast to the chest wall. So they've got that among the rest of us women, because really it's a downhill run from 25. Right, your skin elasticity starts to decrease from 25 and you do this gradual decline, and then your skin thickness really drops. It was menopause. So it's a downhill run after that. And then we know during pregnancy that glandular tissue increases, that breast volume increases by approximately 120 mils, that the glandular tissue takes up much greater volume, the ducts increase in size, and blood flow doubles. So therefore, they're a lot heavier during pregnancy than non-pregnancy. And the glandular tissue is more at risk of injury because it's so much more enlarged and it's delicate, very delicate tissue. We know that as women put on weight, the breasts are actually a fat storage system of your body. So your breasts will become bigger as you increase weight, and therefore there'd be more effect of the breast mass, but also more needs in terms of breast support. We know that more women are having implants now, and so we know that implants will definitely increase breast mass, and it depends on if they've put the implant under pec major or on top of pec major as to how that mass is supported. But in terms of research of these women, nobody's done it. We don't know what's going on with those women. We have no idea. We've excluded them from our studies. Everyone excluded women with an implant. And then we also know, and I've done quite a bit of research with breast cancer, the challenges after breast cancer surgery in terms of all different types, whether it's a lumpectomy, a breast reconstruction or a mastectomy. Those women have major problems in terms of bra design and breast support. Okay, so there's a lot more space that can be done for those women. So basically, you need more support from a bra as your breasts increase in size. And we know that that will definitely happen during pregnancy as well as weight gain. As you age, because of the decrease in your anatomical breast supports, and then depending on the activity you do, and the activity that has high breast movements, such as running and jumping and forceful arm movements, they'll need more support relative to activities where there's less amount of breast movement, such as walking or yoga or gym work. So in terms of an action plan, we need to support adolescents to keep them playing sport. So we need to bring up understanding breast biomechanics and breast movement for adolescents so they understand how to increase their level of breast support relative to their physical activity, because we know they're more sensitive, even though their skin's great, you know, everything's dramatic when you're an adolescent. So they're more embarrassed about the appearance of breast movement. And so understanding how to support the breast to limit breast movement and what type of sports are better that have less breast movement that are going to suit a woman who has a female who has larger breasts. So we need to get this information out to adolescents to make sure they keep moving. We need to support pregnant and postpartum athletes, you know, with policy and education. So there's a lot to do in this space to support pregnant and postpartum women. And in Australia, we've just put in policy to our Australian Institute of Sport to help pregnant and postpartum women. And we've written a lot of education for them that's all freely accessible on the Female Performance Health Initiative website. And that covers fact sheets during pregnancy and postpartum. Also in my Sportsbro app, I've got education specifically for pregnant and postpartum women. But it really needs to come into perinatal education. Like all women need this information, you know, whether you're an athlete or not. We need to support physical activity with women as they age and giving them information about breast support and, again, different types of activity that have breast movement. And then making this sort of mandatory education in women's sport because of the amount of breast movement that's involved. So from a research point of view, there's a lot more finesse that can be done in terms of the 3D movement, because really the movement today, and I have criticised, you know, the breast kinematics movement already, of saying that we really don't understand this plane. We've got this plane, we've got vertical done. Yes, we say we're very good at understanding vertical breast movement. We've got okay understanding about medial lateral, but this plane, really, that 3D measurement is flawed, that is being done with the marker system. There's not enough markers that are being done, and really the work that Lauren and Becky have moved into in terms of that 3D finesse movement, I think they could really do a lot with bra design. And it was really interesting talking to, I'm trying to think who I talked to yesterday, and she was Chloe, and Chloe so shocked. What do you mean women have to wear 2 bras, you know, when their breasts are greater than a double D? Why are you recommending that? Why isn't there a bra, you know, made to support the mass of a larger breast? And I said, good point. There isn't. You know, there isn't. So I don't think we don't have bras that are really supporting the breast mass. We don't have bras that are supporting the population range of breast sizes. So there's a lot more movement that could be done in bra design. And in terms of pregnancy and breastfeeding, there's a lot of complaints from women about bras when they're pregnant and breastfeeding. So there's a lot more room in that space to improve bra designs. In terms of materials and straps, I think there's a lot more room to improve in terms of materials we're using and design of straps that are more comfortable for athletes, particularly in that racer back design. We don't know enough about different populations. We haven't done enough kinematic research on older women, you know, different races. After, you know, we have done limited stuff on women who've had breast cancer, but we haven't really done anything on women with implants or breast reductions and really what that difference is. And in terms of different abilities, we really haven't done anything on any disabled athletes. You know, looking at, you know, if you're stuck in a wheelchair, what's the best bra design for you? You know, we can extrapolate from other things we've done, but we haven't actually measured it. We haven't even looked at their bra wearing behaviour. Haven't looked at anything with any disabled athletes. So it'd be really nice to do something in that space. And there's a wide variety of sports. We've nailed running. Everyone pretty much understand running, but in terms of different activities like rowing, like that came up, you know, last week, going the issues that rowers have with bras, it'd be really nice to look at sports that are very different to running and look at what are the bra wearing behaviour, what are the bra needs of those athletes. Okay, so now talking about sports bra designs. So moving on to the next topic. This is so confusing for women, bra design, and I think it's almost like toothpaste where we're getting saturated with different designs on the market. Right? So which toothpaste should I buy? I don't know, because there's so many different types. But with bra design for sports bras, there's basically 3 designs. There's either the encapsulation design that can be with or without underwire, and this achieves support by lifting the breasts up. So you know when we talked about that movement of the breast like this? If the problem is the trunk stops and then the breast hits its low point. So the strategy with this bra is to lift the breast up. So when it reached the low point, that we're not at the end of tension of our tissue. So if we lift the breast up higher, they're going to be like this instead of like this. Okay, so that's the strategy in an encapsulation bra. So I say to women, your breasts have got to be lifted compared to when you were bare-breasted. So you were bare-breasted, then you put this on, your breast should be sitting high. If they're not sitting higher, then it's not working, right? That's not its strategy. These bras are good for women with larger breasts because they provide more support relative to the second one, the crop top. So the crop top's one piece. So it's one structure, and it achieves support by compressing the breasts as a unit against the chest wall. Right? So it's just going to push them in. And that makes sense because if we decrease that protuberance of the breast, then we decrease that flexion torque. Right? So that's quite biomechanically sound. But there's a limit to how much the breast can be compressed. Because if you compress them too much, they're like fat is a cell with a drop of oil in it. So it's basically a liquid. So there's a limit to how much you can compress a liquid. So there's a limit to how much support this bra can achieve because of comfort. So it's more suited for a smaller breast, a C size, C cup size down, basically. And it has, in terms of structure, because it's one piece, once one part fails, the whole thing fails. So if you have lovely support at the front, you see that lovely high neck, because we want to stop the upward movement as well as the downward movement. But if you go to the back and these are all thin straps, they're going to fail quicker. So once they fail, the whole thing fails. So I think athletes need to understand it's one structure. So the whole structure has to be good material and strong fabric, because if one part's weakened, if I say the back of it's all netting, that's going to fail really quickly. And that's what bras do here. They'll have this nice look at the front, and then this will be lace. And you go, that's a pass right on, is it? You know, so this all has to be very strong material. The last part is a combination bra or a hybrid sports bra, and it's a combination of this and this. And this is research I did back in 2010 and published, saying if you elevate them, why don't we do the both? It's almost like Taco Tuesday, you know. Why don't we elevate them and compress them at the same time and see what happens? So I did research looking at that, and the hybrid bra was born. And basically it gives some elevation and some compression, but it's superior to this bra because of its adjustability, because it does up at the back and it has clips, or it can do up at the front as well, and it has adjustable straps. It's going to suit a wider variety of frames of women. This is going to suit women who are in the middle range in terms of height and trunk size. So if you're taller, or if you're shorter, or you're broader, then this isn't going to fit you, because they're trying to do their sizes to fit the masses, to get the bulk, the middle part of the bell curve of the population of sizes. So there's more adjustability in the hybrid. So in terms of the design features, so the sports bra app that I made goes through educating women about the design features of these bras. And so this is what you get when you go through the app and you click on all these little eyes, and it gives you more information about what to look for. But I've brought this to countries where really English isn't in their first language, and so they don't want to read anything. And I just said, it's got to look like that. If it looks like that, you're right. You know, so this is where the beauty of photographs that we can surpass language. But the band needs to be strong, wide, elastic, and the fabric can't curl up. So we don't want this to be too wide. You know, we want this to be about 1 centimetre, 1.5 centimetres. As you get wider, because the epigastrium's at the front here, and that doesn't tolerate compression, it's actually uncomfortable for women. So it's not wider the better. And also the number of clips, you wouldn't go past 3 clips at the back, because women can't do them up. And they just get really cranky doing them up, or they're doing it up at the front, and then they do the twist around to get around the back, and by the time they get the bra on, they're exhausted, you know. So definitely 3 clips is as wide as you want to go. I teach women the band is a circle, so it's lifting your breast up from the bottom. The band is the most important part of the bra to lift the breast in the encapsulation design. So this part, okay, that's still band. So what they'll do is they'll have this nice band at the back, and they'll come in, they'll have this little wire thing here, it'll go very narrow, and that's the strategy to make you keep coming back for more bra. And so you really need a strong width here, and this is going to be sitting against your sternum at the front. And then in terms of the breasts, they've got to be completely covered. So this, for a sports bra, again, you're trying to stop the up and the down, so you've got to cover your breasts. In something like a fashion bra, yeah, go for cleavage, but don't use that for running. You know, so it's different bras for different functions. In a sports bra, we really want the whole breast covered, and they should be lifted in this design. We want nice wide padded straps, because we know straps cause so much discomfort for women. So this is a vertical strap, and so it's sitting on bone. So this area, if you put your hand on the top of your shoulder, participation, hand on top of your shoulder, you feel you're on bone. That's your chromium process. And that's designed to tolerate compression. But the number of women I've seen that have grooves in that tissue, because there's too much strap pressure, because this is where the breast should be lifted from, not here. This is a secondary support. So we really want them wide and padded for the crossover design. And we've looked at measuring breast movement with different strap designs, and we haven't found any difference. So we're going, it's your preference. Do you like a racer back? Do you like a crossover? But if you are having a racer back design and that is digging into your upper trapezius, I say to athletes, I do that to inhibit muscle activity. Actually strap down muscles after you have a tear to inhibit you activating those muscles, and your bra is doing it to upper trapezius, and you're a volleyballer. What do you think upper traps is doing? It's really important. So you don't want that compression to be digging into muscle tissue. And then underwire is not required for support. So you don't need underwire to have support. Underwire gives nice shape. It's an aesthetic rather than really a support structure. So you don't have to have an underwire bra. If you like having an underwire bra, go girl. You've just got to make sure that it is sitting on bone, because breast tissue is fat and gland, and that will not tolerate compression, whereas bone will tolerate it. So it's got to be sitting on the sternum at the front, and it's got to be sitting in your ribs at the side. And then material is really important. It's got to feel soft and smooth on the skin and not be non-abrasive. So you really need to feel the inside of the bra to make sure that there's no seams, because we know bra-related chafing is another issue that women experience. So in terms of the crop top, really similar, that nice strong band, and this is where it can actually get completely out of control, and you can have bands that are this wide. And you go, what are we doing that for? And they're just rolling up here. Women, like, this is a beautiful flat abdomen, but you know, that's not everybody. So we've got to cater for, make sure that they're not going too wide. And this lovely wide, high neck and material that's compressing the breast. So they should look side on. Say to women, you should feel this is compressed against your chest wall. And once you lose that compression, that's telling you that your bra is now not limiting movement. So if you're wearing a crop top and you don't feel compressed, that's its strategy. So it's actually not going to limit breast movement. And then same thing with the straps, particularly if we're going over upper traps, that we've got to make sure that we're not compressing them. And then that, again, that same idea with the material. This is a popular bra for women who are doing long duration sports, like marathon running or trail running or something that's long duration. Like I'd say a lot of the rowers are wearing this, but it's that inside that you've got to feel that it's lovely and smooth against the skin to limit issues with chafing. And then the encapsulation bra, same thing in terms of quality, but now we should feel a lift and a compression. When you look inside these bras, you can see there's two separate cups. And again, that material is going to be really soft and smooth. But our research has found that design is so important. You've got to have the right design, but if it doesn't fit, it show's over, right? So like a shoe, you could have a great design boot, but if it doesn't fit you, it's not going to work. So the same thing with bras. They are a tight fitting garment, so they have to actually fit correctly. So the band should be firm and comfortable. The cup has got to cover all your breast tissue, and the strap's got to be firm and comfortable and stay in place. So we've spent a lot of time going, you have to get design and fit right in order for it to work. Because we know when we've got women to run in bras that are too big, that they have too much breast bounce. They've got the same design of bra, one's correct and one's too big, and you can see there's more breast movement in the one that's too big, so we get that breast bounce. Same thing with if it's too small, that there's breast tissue that's going to be bulging out the front or the sides of the cup. And so again, that'll allow excessive breast movement. The other thing I want you to see here is that it's not that we have no breast movement. So Stop the Bounce was a really poor advertising campaign, really poor understanding. So it's not like you don't want any breast movement. You see with this woman, she still has breast bounce, but they're lifted higher. She's not reaching her end of range, and we've decreased with that rapid deceleration that she's having. So this is far more comfortable than this. But again, she's wearing 2 bras to achieve that level of support. When we've researched athletes, and this has mean physically following athletes around sporting competitions and looking at what they're wearing, does it fit and is it supportive enough? And this is the advantage of being a clinician. That's actually really facilitated my ability to collect data like this and to go to sporting events and be in the change room with athletes because they're very comfortable with physios taking off their tops in front of physios, that we've looked at what they're wearing and we've found that, you know, greater than 50% of wearing bras that are either don't fit correctly or don't provide enough support. And like the winners were international cricket players where it was 90%. And there were, you know, professional athletes wearing a lucky bra to competition for 7 years. 7 years, same bra. I'm going, can we keep it in the bag? And can we put something else on? You know, so this is a real problem that women don't know what good support feels like, so they don't know what they don't have. And the bar is very low in terms of bras. So we know breast support increases with breast size, age and type of activity, with weight and breast size. And we know it changes as women age, and we know it changes that the breast becomes stiffer after breast cancer surgery. So that we've got one stiff breast and one normal breast. So we've got this asymmetry, which is really uncomfortable for women. So we've got to try and even that up. But, you know, breast implants, no idea. Like assume, but we don't know. So we recommend still greater than a double D cup if you're doing a sport with a high amount of breast movement, that we recommend, sorry, there isn't a bra on the market we think is supportive enough, that it's highly likely you need to wear 2 bras to achieve sufficient support. So in terms of the action plan, like where do we need to get this information? We really need to get into schools. We really need to get this basic information into high schools to keep them going. We need this to be part of player welfare in sporting organisations. We really need to put it into perinatal education. There needs to be far more in breast cancer. So in Australia, I've been educating breast care nurses and oncology physios to implement this to women to try to up the game of physical activity, because we found, you know, after 2 years after breast reconstruction surgery in our breast, that cohort, which was a younger cohort compared to mastectomy and reconstruction, it was 40% had not returned to their sport, not resumed their sport. You know, and bras are one of those barriers, right? There's a lot of barriers, but bras are a fixable barrier. It's something you make actually do something quickly and easily to resolve. In terms of research, this 3D bra design in greater activities in greater sports, different populations of women and different abilities. Again, looking at disabled sport, we really haven't done that. Far more integration of science and sports bra design in terms of materials, in terms of strap designs, improving support for the larger breast and bra size standardization. Like, you know, the number of males I've talked to, like my husband included, who've gone, cups the front, clips the back. Really, what's the problem? Why can't women get their size right? And I'm going, well, darling, there's a lot of issues. Like women won't be one size in different bras. Like even bras within the same manufacturer, even bras that are the same style, that because they dye them after they make them, which changes the fitting. So that's a problem, that there are a range of styles. So bra companies don't standardize their sizes. And mothers haven't passed this information down to daughters. So women are not taught, not understood about bra design and bra fit. And then on top of that, women find bra shopping, you know, it's up there with swimmers. It's exhausting and it's unpleasant and it's terrible. So often they will just go and buy the same one again, not to go through that experience again, you know. So we have to facilitate and make that easier for women. Okay, last topic I wanted to talk about was breast injuries. So this is something we started to research back in 2017, and we just threw it out there as an idea, you know, just watching sport, like they're getting a few impacts, but when do we see what's going on? So the first study we looked at was across 31 different sports, and we just thought, let's explore and see are women getting injuries to their breast. And we went back in the literature, you know, back to 1970 and looked at epidemiology of injuries in women's sport, and there's nothing said about it. probably isn't a problem. And we were flabbergasted about when we specifically asked, and I think this is the issue with women. We're going to have to specifically ask them because they're not going to volunteer this information. So when we specifically asked, we were floored about how many women had had an injury to their breast and how they hadn't told anyone about it. Okay? So what we found in terms of prevalence across those 31 sports, 36% had had a previous breast injury. And more so in contact and combat sports. They were the sports that had more injuries. But remember, this is lifelong prevalence. Have you ever had a breast injury? That's what we threw out there. And then research in America done by Laura Smith, who's a physio in America. She looked at college athletes across a couple of sports, and 48% had had a previous breast injury. And then the winners, right? So then because of this contact and combat, and because I already had connections with League Union and AFL, I said, oh, why don't we look at football codes? And they won with 58% had had a previous breast injury. So then we've explored more about League and Union and looked at, well, what's the prevalence per season? And 40% had had an injury in the previous season. So this is a bit too high, in terms of injuries. And we know that if you have our stats of these studies, if you have a larger breast size, you're greater at risk of having an injury. And that makes sense because there's greater protuberance from the chest wall and greater surface area of the chest wall that's been covered. And we know that the type of injuries we're getting a compression and a shear, and that's because of that perimeter attachment. But this is all self-reported data. So we're not getting data where these injuries are being assessed by a physio or a doctor, because 90% of these injuries were not reported. So athletes do not report these breast injuries. When I looked at cricket, the prevalence in cricket is lower, but the severity was nasty because the most common mechanism was a cricket ball to the breast. So it's like 3 weeks of swelling, bruising, didn't tell anyone. And you've got physios there. So we've looked at severity. This is football code data. This is League and Union. 63% had moderate pain, but there was some that went up to severe pain. Generally, that moderate pain lasted 2 days to 2 weeks. In terms of bruising and swelling, 70% had bruising and swelling. It lasted somewhere between 2 days and 2 weeks. 60% reported that it limited their capacity to run. So they're warriors. They get this blow to their breast and they keep playing, but they don't play as well. So we've got this limitation of running, but also half of them had a reluctance to engage in a tackle again because for fear of an impact to the breast again. 7% had long-term changes to the breast, and the most common was lumps in their breast after that injury, what we call breast fat necrosis. And then, this is a severity that warrants assessment, warrants physio or a doctor assessing that breast and monitoring that breast to ensure tissue recovery. But because they're not reported, then, and we don't have data, we just are presenting a study this at this conference this year where we really tried to get prevalence data. We looked at, okay, what are the barriers to athletes reporting, and let's try and instigate something to change that. And we did that, and we collected surveillance at the same time as we did retrospective survey data. We weren't game to just do surveillance because we were so afraid of the issue of non-reporting. And basically the strategies we implemented were insufficient, and we had 3 injuries reported, whereas, we're up to 40% when we did that retrospective. So our retrospective was consistent with previous research, but in terms of prospective surveillance, we're going to have to invest a lot more in changing the behaviour of athletes than the strategies that we put in. The reason why we want to get athletes to report these injuries and do something about them is because breast tissue is not the same as muscle tissue, and that breast tissue can have potential long-term consequences. And the most common of that is breast fat necrosis, and that's where you damage the blood flow from the bruising, you damage the blood flow. If you remember those little pockets that are in that anatomical dissection of the breast, that you'll get death of fat cells within those pockets, and that's what will form the lumps. And that's going to happen about 2 to 3 months after the trauma, right? And the problem with breast fat necrosis is that on imaging and on clinical examination, it looks like breast cancer. So it's going to take a biopsy to distinguish between the two. So that's why we want to try and manage these injuries, to treat that bruising and swelling, to promote that blood flow, to promote that tissue healing, to limit the risk of that occurring. We also know that it can cause breast deformity, and we know that with athletes that have implants, that the compression and the shear can be enough to cause a bursting of the implant. It can be a slow leak of the implant, so which will cause the implant to have to be replaced, but also really mucks up the lymphatics as that tissue, that either saline or silicone from the implant is seeping into the breast tissue and then into the lymphatics. And also we know we've got case study data of gymnasts actually falling on the bar and impacting their breast, that it affects the growth of the breast. So remember I said the glandular tissue penetrates the breast from the areola, from the nipple, and then spreads throughout the breast. So if you've got an area of your fibrofatty mound that is bruising, or you've damaged that duct tissue so that the duct doesn't spread, that mound won't grow in that region. So the glandular spreading and the mound growing are united, the simultaneous events. So if you affect one, you'll affect the other. And the problem with adolescents is that they're so sensitive about their breasts, they don't tell anyone. So those 2 case studies were actually diagnosed 3 to 4 years after the event, when the breast was like really asymmetrical. So to educate adolescent athletes about this is important, to go, hey, if we treat you, we can stop that occurring. Like, just tell us and we'll help you. And then in terms of, we've got more sport, like at the moment in NRLW, like our National Women's Rugby League competition, we have 11 players lactating. So this is getting bigger. Like, go girls, we're getting these women coming back to sport, and often they want to breastfeed because they want to raise an athlete. So they want to try and get, if they can breastfeed, they want to breastfeed because they want to raise the best physical human they can to enable them to be an athlete as well. So because of that doubling of blood supply, increase in the size of the glandular tissue, the surface area, the size of the ducts, they're far more vulnerable to that compression and shear. So we do really need to educate women about, hey, muscle tissue, bruise to your muscle is different to a bruise to your breast. Please don't equate them, because athletes go, oh, I'm in pain everywhere. I'm an athlete. Everywhere hurts. I get bruises everywhere. I'm not going to complain about that. I'm a warrior. And you go, well, when it's your breast, you love your breasts. Women love their breasts. Men love women's breasts. Babies love breasts. Everyone loves breasts. Why don't we look after them as best we can? And if you tell us, we'll look after you. You know. So I think physios and doctors really need to be onto their team. You go, who's lactating? Who has implants? And we manage those. We also need to not scaremonger, right? And I think that's what's happening with breast protective equipment, particularly, you know, my experiences with these adolescent athletes, where they say, oh, you can injure your breast, all of your girls need to wear a guard. And I'll have private schools in Sydney ringing me up and saying, oh, our P&C committee wants to buy breast protective equipment for all of the girls in the rugby team. And I go, isn't that great? And they go, can you tell us which one to buy? And I go, are all your girls in high support correctly fitted sports bras? And they're going, what? I go, well, I've got a bucket-load of evidence to say they should be, but I cannot tell you. I can't go hand on my heart, you should be wearing breast protective equipment. I can go hand on my heart, gee, you need to look at tackling technique. Are you training them in that? I can tell you that with my hand on my heart, but I can't tell you a brand that I go, yeah, that's the one to wear, because there's no efficacy for them. So I think we need to calm everyone down, going, this isn't common, this is just another injury you can sustain that your medical team can manage if you tell them. So can you please report these injuries? And can we please give breast injuries the same respect we give to every other sports injury, where we go to this very complicated system of working out what we should do to prevent those injuries, where we look at identifying the mechanism of injury and analysing the events and incorporating biomechanics. And we have definitely been looking at that with rugby league and rugby union and looking at tackling technique. And, you know, definitely with the impacts we've looked at in union, a high percentage of those impacts to the breast are illegal tackles or poor tackle technique. We go, why don't we look at changing tackle technique to try and prevent breast injuries instead of going, oh, let's just stick them all in the garden, shut them up and move on. Get those. I think, can we give women's sport the same respect we give to men's sport? We have to look at the player situation and the rules and the opponent, the different heights of the opponent, the different tackle heights that they're tackling at. We need to look at contributing factors, both internal and external risk factors. And this is where these issues of implants and pregnancy and lactation really need to come into. And let's develop targeted prevention strategies. Let's get our coaches together, our athletes, our medical team, our researchers together, this collaborative team, and work out how are we going to manage these better. And looking at training, neuromuscular skill training and development. So this is where we're really looking at in rugby league and union tackling technique. I think I'm not anti-protective equipment. I mean, there's going to be a place for it, and there's going to be athletes, you know, particularly after an injury, or if they've just paid £15,000 for implants, gee, they want to protect those, or if they're lactating, then I think there's definitely a place for protective equipment. But, you know, at the moment, I know all the ones that are on the market, and there's not one that I'd go, that's the one, you know. And then in terms of looking at rule modifications of you know, deliberately causing trauma to another woman's breast. But surveillance is absolutely necessary. So this is where I've been involved with you know, organisations who are collecting surveillance of breast injuries, and they're going, oh, Deirdre, it's just a nightmare. We can't do this. This is really hard. And I go, look, I'm just asking for breast injuries. I'm not asking for breast health. I understand that collecting all these health things about women is just bombarding data collection and surveillance. But this is an injury. So can we just give it as an injury? So this is why I think we really need to do surveillance. But how can we do surveillance if 90% of injuries are not reported? So we really need to look at these barriers to reporting. And this is what we're currently researching at the moment, and we're presenting it at Sports Medicine Conference in October to try to give sports strategies, best bang for your buck, to try and change that behaviour of athletes to get them to report them. But we also need to work on recording. And in Australia, I've managed to have some impact, and I've changed now, I have a breast injury item on the ORCID injury surveillance scales on Smarter Base for rugby league and for rugby union, and now for AFL. So I've made baby steps of changing impact, but I think we really need to get this into as an item into surveillance across multiple sports. Because we have also an issue that these women are warriors in they don't take their time off sport. So we need to look after them so that they continue to play, because they are continuing to play, but with a decrease in performance. So we need to educate the athletes that your physios and your sports trainers or athletic trainers can actually help them so they can perform better with their injury. But the knowledge of health professionals and coaches about breast injuries is really poor. So we really need to get information out to the key people, key stakeholders involved, so they're aware of these injuries and how to manage them, because the coaches are going to be absolutely imperative in breast injury protection. So moving forward, we really need recognition of breast injuries as a female-specific sports injuries. We need behavioural change for both athletes and staff, and we need organisational change in terms of developing policies and regulations and guidelines. For example, with breast protective equipment, it's free-for-all. They're wearing anything they want. They don't know what they should be wearing, so often they're wasting money buying multiple guards until they find something that's comfortable. We also know they play harder when they're wearing a guard because they perceive they're more protected. So I've got an athlete wearing a guard, athlete not wearing a guard. This athlete is playing harder. So is that changing the nature of our game? Because if they're wearing a helmet, you can see it. So in terms of concussion, but if they're wearing something under their top, nobody knows, right? And these are the range of breast protective equipment on there. So there's, you know, thermoplastic ones that you insert in, There's different types of foams and paddings that are incorporated into some type of top. There's other different types of materials that are either, this is like a resistance foam, and this is like hard impact plastic. But we found a third of players actually perceive if I just compress my breasts against the chest wall, that's how I protect my breasts from when we've asked them. So, and that makes sense in terms of that protuberance. So if they're closer to the chest wall, it's going to be harder to shear them. So, you know, just educating them about breast support. But we really need efficacy of these, because these have all come onto the market with no testing that they actually attenuate breast force anyhow. So in terms of an action plan, there needs to be widespread dissemination to every stakeholder involved in terms of breast injuries. We need to calm everyone down that this is just another injury you can get. You can get concussion, you can tear your ACL, you can injure your breast. But the benefits of sport outweigh those. You know, the benefits of playing rugby, this sport that you love, outweigh this, and we can help you and we can manage it. Your medical team can look after you. We really need to upskill clinicians though, because definitely one of the barriers that our research has identified is that athletes perceiving that clinicians were not competent or confident to treat their breast injury was a barrier. So they don't trust that you know what to do in here, and you're asking me to expose my breast to you. So that's a big step for me to overcome. And definitely clinicians have told us, that were the ones that we surveyed, no, I don't really know. Ice, I sort of go, put ice on it, and then that's it. And then in terms of policies for surveillance, I've made some baby steps, but you know, really it's a long way to go to getting it that it can be recorded, other than putting it under an other item, which would be in a lot of surveillance. This is under other. Surveillance will enable us to get an incidence. We really need incidence data of really how frequently this is occurring, so we can look at relative risk. We really need to understand mechanism of injury across multiple different sports in order to work out our prevention strategies. And we really need to investigate more and understand more about equipment and its efficacy. And that's it. I think I've exhausted everyone. Thank you very much.
Thanks, Deirdre. That was really informative, and I think it's covered a lot of different areas that reflect, I think, a lot of the different skill sets in the room, and hopefully online as well, which is fantastic. So have we got any online?
Yes, we've got a couple of online questions, and yeah, thanks again, Deirdre, for sharing all of those insights. So we've just got one. Does training the pectoral muscles help breast support as well?
No.
No.
Because they're sitting external to your breast, to your pecs. So no, making your pecs stronger won't. Pecs are going to be encased within the bra as well. So it can make your breasts look bigger. But you know, when athletes say to me, oh, how can I make my breasts look bigger? I said, put on weight. It's a fat storage system. If you put on weight, your breasts are going to get bigger. Right? So rather than making pecs, but no, it won't strengthening them won't give you more support.
Yeah. And what options are there for effective with women other than well-fitting bras? So I think this was around the idea of pain and discomfort.
Yeah. So there's quite a lifestyle changes in terms of you're looking at dietary changes that can be affecting with breast pain. So they look at caffeine and chocolates and different foods. You know, the medications they give, starting off with anti-inflammatories and paracetamol, but then it goes down to hormonal drugs for severe intractable pain, evening primrose oil, acupuncture. So there's a lot of lifestyle stuff that can be implemented if you talk to your GP. I just wrote a chapter, the first sports medicine chapter on managing breast health and breast injuries. In females, it's in clinical sports medicine. It should be published any time now, like we've done the final proof. So, and that has a whole section on breast pain for doctors and physios in terms of managing that.
Perfect. And then there's another one. So is there any data around the level of impact on activity / participation of women due to breast support compared to other factors that you're aware of? So such as body image, social factors, or in postpartum?
It's one of this whole conglomerate. Yeah, so definitely it's one barrier amongst many barriers. To say for breast cancer, we asked women to rank and it came out as number 3. So it's pretty up there. I think the key thing is that it's solvable. Like so many of the barriers are really challenging to overcome, and this one's really easy. So it just goes, oh, just do it.
Mm-hmm. Yeah, no, definitely. And are there any questions from the floor?
At the start, you were talking a lot about the hormonal fluctuations,
Mm.
and then you also mentioned like breast volume. Is there, I don't know if there is any data on this, but is there anything that says because there's potentially a change in breast volume during the menstrual cycle, might there be a need to potentially change what size bra you might have if you do potentially have those symptoms that are leading to that those issues that you mentioned in that first slide, if that makes sense?
In terms of research to prove it,
Yeah.
I don't know of it.
Yeah.
In terms of practical implications, do I recommend it? Yes.
Mm-hmm.
So I have athletes that have their period bra, the bra they wear around their menstrual cycle, and it tends to be larger in size for the underneath one, but they put a crop top over it. So actually go for it. You have your bigger size bra, so you're encapsulating all your breast tissue, but you're actually wearing more support. So they may be a one bra athlete the rest of the month, and around their period they're wearing 2 bras, and they definitely find it's more comfortable.
And is it when they're on their period that they?
It's a couple of days before.
Yeah.
Once the period starts, it starts to reside.
Yeah.
But there are some athletes who have it around ovulation.
Yeah.
That's not as common. This is the more common, but it can be either. So that's why, you know, they're looking at, we're trying to treat the pain. The current medications are really focusing on pain, but maybe there is, you know, the study in Australia found higher progesterone, you were less likely to have cyclic mastalgia. So, you know, that's interesting, but it was 26 athletes. So we haven't got a large sample size. So it'd be interesting to look at, is there hormonal fluctuation that were different? Definitely, there's very limited data, but I'd say anecdotally, my experience is after pregnancy, women have less nostalgia. So again, you think probably something going on there. What's different?
And then in the study that you did with the elite athletes, where there was 50% of them not wearing the right bra, I'm just curious, did they think they were wearing the right size bra, or was there almost like, I'm just thinking of some of the sports here in the UK, like high rush triathlon that I'm involved in, there's a lot of like an aesthetic component too. So are they wearing the potential wrong size because they think it fits, or is there almost like an aesthetic aspect as well that's helping with the decision of picking a bra?
I think the aesthetic decision comes to picking the wrong style of bra.
Yeah.
I think the poor fit is because they don't know what to look for. You know, they don't know how to tell if it fits. And also they do really think about bras as underwear. They don't think of it as, oh, this is to support my breasts. We haven't sort of moved there. Like I've been saying, I feel like I've been going on 4 years. A bra is the central piece of sporting equipment for a female athlete. I've been nagging that on. I'm sick of hearing myself, right? But I don't think that's there yet. I still think they're looking at it underwear. So say the stuff I did with the WTA, those athletes, they get their uniforms given to them by their sponsors, and the bra comes after the top. So if the dress is doing this, right, just covering one shoulder, so will the bra, because it's got to match the top. And I'm going, it's going the other way around. Yeah. You do the bra first, and then you do the top. And then they're not thinking about design at all in terms of support. And I'm saying this company that made you this clothes, they make a really good sports bra. And so here's the picture of it. And next time you go, I want that one. They've given you this one, don't have that one. This is much better. But what I found absolutely consistently is I'll have, you know, athletes coming, they go, I don't have any pain, Deirdre, I'm fine. You know, you can help the others, it's not really me. And I go, okay, that's great. Why don't we just have a look at what your, you know, what support you're given. Actually, can we open the app? Have you got internet?
Yeah.
And I'll show you what I do in the app. And this comes down to research questions, right? Because if we research and say, we're trying to manage breast pain, which we are, but we're also trying to make athletes more comfortable. So if we only ask, so we've got bra.edu.au. bra.edu.au. Okay. Yeah. So this is the app, and this goes through, you know, you say, do I wear crop tops or do I wear a bra with cups? And you put in your region. So like if you're UK, then it will come up UK sizes. And then I'll put this down. And then if you put in your, you know, your type of activity, so there's this little eye that says, you know, this is a large amount of breast movement, this is medium amount, small amount. Then it shows you what type of bra we recommend. And again, remember, I'm saying I'm only recommending, I'm only guiding women. I'm not saying you have to wear this, because if an athlete says to me, no, I want to wear this, and I go, go. Then we'll make a decision where together, is it supportive enough for you? So it goes through what to look for. And basically, if you're small breasted, you can wear any type of bra you want. And then it goes through how to fit your bra. And you'll notice when I'm saying when purchasing a new bra, there is no measuring tape, right? I have bagged out that whole measuring system. You know, if you're going to do anything, this is the only measurement with any credibility. This one is a joke to measure anything about bra size. And then it goes through how to tell if it's fitting. So, and you play these little videos. Move it out of the way. Get up here. Of saying, you know, it should feel firmer in your trunk, and then you pull it, sort of like, see, I pull it and go, it should feel firm resistance against the trunk, and then you should be able to move your arms up and down, and the bra doesn't move on your trunk. So it's just giving women basic, you know, information. It's just taking a long time to load. So I'll move on, but it goes through the same with cups, straps, material, underwire. And then this is the part I wanted to show you, and how to tell if your bra is supportive enough. So I say to this athlete who goes, I don't have any pain, Deirdre, I'm cool, bra's fine, you know, I'll see ya. And I go, okay, can we just do this? So I get them to run in front of a mirror, and I go, you look at your breast movement. And it amazes me, women have not looked at their breasts before running. And then, and relative to what sport you're going to do. And then I say, well, you rank how good your bra is for you. So this is breast discomfort, and I go for 10. And this is where, you know, I've done this to women who don't speak any English, and I'm going 10 and 0, right, for discomfort. And then breast movement is running with nothing on. So if you were running bare-breasted, how much would your breast move? And 0 is no movement. And I say to women, you deserve a 3. You deserve to have no discomfort, and you deserve a 3. And then I show you down here, this is what a 5-6 looks like, this is what a 3-4 looks like. So I'm trying to educate women of how much movement is supportive enough. So I get them to run, and then in their bra, and they look at their movement, and often they are shocked at how much their breasts move. And I go, instinctively, your brain is gripping onto your breasts, and you're wasting your muscles on supporting your breast when your bra could do that for you. And then I put them in a high support bra, and it is absolutely consistent that they go, right, this is so much more comfortable. I didn't have any discomfort before, but I'm much more comfortable now. So see the way we put our research questions, where we're measuring comfort instead of discomfort. Because if a woman has no discomfort that she is aware of, she doesn't know how comfortable she could be. So this really works. And you know, when I did the cricket players first in Dubai, you know, back in 21, and I had women coming in who didn't want to, you know, they came in because they were, you know, coming in with their team, and they're going, I love this bra, you know. And I'd say, look, can we just try this, because they all got bras, can we just try this, you know, maybe have a go in training, because we want to do some post, you know, survey stuff to see what you thought of the bra. And they all wore it all the time. I'm never wearing that thing again. Like, you know, this is just fantastic, you know. So I think that's where women don't know what they don't know, and their bar of bras is really low, and they don't see them as being equipment, so they don't see, actually, you know, I can move better. When I did this I've done this for all the tennis players in the Miami Open. So that for the WTA, they do physicals for their top 140 players in the world. And they have all the physios there now do this assessment as part of the annual screening that they do of athletes. But I couldn't believe how poor the bras were there. But they were so shocked at seeing their breasts and seeing how much they move, and were so surprised about when they're in high support what it looks like. And you think about tennis and your arms up here. You want this up and this pushed in because you want your trunk upright, because you want to absolutely have optimum biomechanics with your arm above your head.
On a similar note, you mentioned biomechanics a lot, but is there any data around like physiological variables, things like running economy and bra fitting too?
One
Link to that in the research, if there is, are we potentially doing a disservice for females in research if we're not making sure they've got the right fit and size, if we know that physiological variables that we're measuring might change as a result?
I don't say that. So I'm not sure so first part of the question I go, one study has looked at running economy, and yes, they found that there was improved running economy wearing a high support bra, and it would all have to do with posture of the thoracic cage. And it's more got to do with larger breasted. That's where it's really going to have more of an impact. However, women on the reverse side complain that if the band is too tight, and some women do not like a tight band, that they feel it restricts their lung capacity. We measured that. We put their respiratory in and looked at that. We didn't find any difference in respiratory function, so it was perceived, but they don't like it. So there's two sides to this. We can't make women uncomfortable. They actually have to be comfortable. So if you're going for that change of more support, so I think comfort is going to win, and it's not going to be huge changes to running economy unless they're very large breasted. And it says large breasted runners. But like say with the WTA, because like I came and trained all the physios and there was so much noise about bras, because these tennis players are going, I've been playing professional tennis for 15 years. No one's mentioned a bra before. How come no one's mentioned before? And I go, yeah, I know. But because I spend so much time looking at breast movement, the other researchers and clinicians that were with me, when we'd go and watch the tennis, they'd say, you've ruined it. You've ruined tennis for me, Deirdre, because all I'm watching are their breasts. all I see now. So if you start now that I've drawn your attention to it, you'll start watching breast movement and you think, wow, I'm just moving along.
Yeah, definitely doing that in the rugby on Saturday. Yeah. We just got one more question online. So, at what age do you recommend starting these conversation with girls? And would there be a different approach between, say, a mother-daughter relationship as opposed to in a school setting?
Yeah, so I think I've definitely we should start it in high school. I think that's when we should start these, and I think that's where it needs to come into curriculum. In terms of running mother-daughter sessions, I found that highly successful. Because the mothers wanted the information for themselves and the mothers buy the bras for the daughters. So I think mother-daughter sessions work really well. In terms of high school curriculum, we really have to be conscious and considerate of male, what we call them PDHPE. I don't know what you call what is it, just PE here?
Yeah.
PE. So we call it physical development, health and physical education. There definitely needs to be respect and consciousness to male teachers. So it has to be facilitated that they can play something and then leave the room if they're not comfortable. Same thing like we're doing with male coaches. This initiative to bring this into women's sport and into schools really needs to be female led, because it's a very sensitive topic and it can put males at risk of misinterpretation of their intentions, and it can be very uncomfortable or sensitive for females that they'll just tune out and they won't buy in. So it has to be handled very sensitively. And I think we're working with rugby league to work out safe conversations that male coaches can have with their players and what strategies they put in place. So that's another project that's going to come out this year. But I think we really need in that school space or in that sports space, mother-daughter sessions are a great initiative.
I think this is just a challenge, but it might be a perception, is cost. I think when we start going down to grassroots and schools space, there is a perception about cost. You know, yes, everyone will support the rationale and why it's really important. But I do think that's something that we have here in the UK that's a challenge, is the cost to fund a really good sports bra.
So I don't think, particularly in adolescence, you need to spend so much on sports bras. So this initiative is just to get the education out to connect women with better bras and empower females to buy better bras and stop buying the rubbish, because there's rubbish out there, but there's decent bras out there. But these characteristics that I show you in the bra, like in Australia, you can buy this at Target. You can buy
I
this
think
at
that's
Uniqlo.
important for us to promote that alongside all of this, because there is a perception, certainly sports bras are really expensive. So I was thinking of the mother and daughter sessions in schools. I just know nearly that would be a barrier. So that should be part of our promotion. Whatever steps we take forward.
So none of the bras in this resource are branded. So I'm not associated with any bra company, and it's just showing you the features to look for. But if you know the features to look for, you can buy them anywhere. And we do need to explain, when you're an adolescent, you have this great collagen, got great skin, and so your need for a high support bra is less. A lot of them will get away with a crop top, you know, and you just need to have that good material in the band that's it. And then you decide, you use that third part and you decide, is that supportive enough for me? So you want to be around that 3, 4. But this is where you now can go to it at any store and give it a go and see, you know. So I think that's what we're trying to connect women with better bras. So in countries when I've gone to, say, the Middle East, or when I've gone to the Pacific, and there's been so limited access to bras, right? So that I definitely agree with you, and access, that's a problem. So what we've done for, say, New Guinea, so our New Guinea is now starting to play rugby league in Australia. And when they came to Australia, we had a foundation called the Sports Bra Project, which started in America. And we've now have a hub in Australia. Teams can apply to the Sports Bra Project and they get free bras. So the Sports Bra Project runs bra drives. So they try to make sister teams. So we may have a rugby league team in the eastern suburbs of Sydney, which is more an affluent area, have a sister, in country or regional New South Wales, and these girls supply bras to these girls. So we're creating networks of sister teams that we're providing access where they can't get bras, but also from a socioeconomic point of view. But in countries in the Middle East and in the Pacific, there's maybe one shop that sells sports bras. So then the team are going, so I'm showing them, this is the good, so I go, show me the bras you buy here. So they're all taking off their tops, and we pick out and I go, this is the bra, girls. This is the one we want to buy. And see this one, don't buy it anymore. And you go to the shop, they go to the shop and they show them this bra. And they go, we're all buying this bra and we want a discount and we're not buying these anymore. Okay, so you bring them in, we're not going to buy them. And we're going to spread the word. And this is giving power to the masses. We're not buying that crap, you know. So I think that's the type of education we want to get out. And that sells itself or lends itself beautifully for team-based education and power to the women. So what we're doing in community sport is that we're training trusted women associated with the team how to run a 30-minute session to teach girls about breast support and bra fit. So it's practical, it's run in the change room, there's no PowerPoint. They just use the app on their phone as a backup and learn that strategy, and then they assess each other's bras. So really simple, you know, crappy day, we're not going out, we're going to do something inside. Let's do a breast support bra fit session. And they're all wearing bras. So we're looking at what they're wearing when they're at training. So at a more elite level, I'm training physios. So I'm training a group of physios tomorrow here, how to teach this to the team. So they either run physicals like the WTA are doing, incorporating into that, putting it into their treatment, which they should be doing anyhow, or running team-based education. And then the physios can be like our top tier. So when we have these women, and we're training women in pairs to do this, to run this for the team, we found when we did one at a time, it was a bit harder for them to have the confidence to do it. But 2 women working together, they run this session and we give them everything they need for that session. And then that'll solve probably 85% of the problems for that team. And there will be some people that have problems, and now we have a pathway of where they can refer to try and solve problems that are, you know, special to them. We're talking about women that have more significant breast asymmetry. Most women have breast asymmetry, but some women have it more extreme. So issues like that, you know, how are we going to manage that for you? So yeah, but I wanted to show you this because in the education part of this, there's a whole lot of, you know, education about different bra designs, and I do like breast support facts. You know, so just little flyers that you can put out around the room, or you could send out in an email to your team about breast movement. You know, so they're all very short, pregnancy and breastfeeding, the barriers that those women have, but also this is a really important one, how to care for your bra. You know, so if you put it in a washing machine and a dryer, it's not going to last you very long. So how do we teach athletes how to maximize the lifespan of their bras? And I think when you're working with elite teams, it's really important that they don't put it in the hotel laundry, because, you know, I've been at events and, you know, within 3 weeks of the event, the bra's trashed. And it's because they put it in the hotel laundry every day. So a hot washer and a hot dryer are really going to decrease the lifespan of your bra. So this sort of basic information is there, and it's all bra related, you know, so it's not be all and end all. The Female Performance and Health Initiative resources is far more broader, it gives more detail, but this is all related to bras.
Any other questions, or you can wrap up?
I've got one, hopefully it's not, I think it's a lengthy one, we can play later, but, so firstly, I just really wanted to compliment you on your approaches, because this is a really good, within the world of sports engineering, you know, I see a really good partnership here with the athlete. You know, there's bits that you're listening to the athlete really closely, and you say, whatever I do, they're right in their view. You know, they're not going to compromise on certain things, and allowing expertise to come out of from the evidence, I think, is a really good way of doing it. I've seen so many examples of, you know, scientists says this is the way to do things, and they may be right, but nobody's listening to them because they're not engaging with them, and vice versa. You know, sports bra designed by some celebrity athlete, that's no good either. So complimenting on that. My question was going to be more about on the injury side, and it's to do with the definition of an injury, and I'm thinking of the parallels to some of the work that Jai's doing over here with where we're looking at the sort of long-term neurodegenerative disease in heading and things like that. Is most definitions, as I understand it, of an injury would be playing days lost from a sport.
Yeah.
And a lot of what you're talking about here is not playing days lost.
Absolutely.
So there would be people that argue that's not an injury.
Yeah.
But you're saying it's significant. And I'm wondering whether there's just something in the definitions of the language that might need to change to help us monitor events that are happening that might then have consequential developments and so on. And just some thoughts on.
I think I've made enough noise now in Australia that I got, you know, and I'm getting, you know, older and crankier. So like they're saying, like, how am I going to shut her up? So, you know, I think I'm saying there are potential long-term consequences here, and we can manage this, right? We need to do surveillance. So I keep saying, I'm banging on, we need to do this, and the only way we can do it is if if we can record this other than other, because that's what you're making us do, and that's why that's part of the problem. So it's not solving the whole problem, because the reporting is a really big problem, but that recording of non-time loss, that's where I go. If we medically report it, so we've got 2 in Australia, it's time loss and medical report. And so we're hitting it via the medical report, because there won't be a time loss. And I'm saying to the athletes, we won't take you off. You're going to play on, and we're here to help you. We will help you to play better, because if that's padded, and we're doing subtle things like we're running onto the field and go, hey, breast okay, like you're going to blow. And it's all whisper, you know, and they're going, yeah. And we get Jordan pad there, and we just have little round pads that they just slip in themselves. All very subtle on the field. Halftime, yeah, we'll come off and we'll put them in a crop top and give them all breast support. But we're here to support you to maximise your performance. So I think the medical report is where we're putting it in terms of surveillance. I am a nightmare. Like Keith Stokes was going to me, injury, this is just another nightmare because the injury surveillance is just is so huge. And I think part of it is because we're collecting health data. I still think we need to collect health data, but maybe it's not all the time. Maybe we need to back off a bit because we're definitely pissing them off. The athletes are exhausted from us asking them questions about how they are, So we need to know it, but I think that can have decreased frequency. But I think it needs to be respected as an injury because of the potential long-term.
Sort of recover, I don't understand how the tissue would recover, for example, but the concussion guidelines would say you need a period out of play once you've had a hit that blows the head sort of thing. Could you see the same sort of thing?
No, well, I'd say we'll protect it until we get rid of the bruising and the tissue goes back to normal. And that's why we need to know what the tissue was like in the first place. So I have athletes and they're out there with their breasts and they love them and they're showing them. And we've got athletes who never look and never touch their breasts. Okay, this is the spectrum of women we're dealing with. So we need to educate women to know the normal look and feel of their breasts. And so then we know what their normal was. Is this different to normal? Does this feel different to normal? Some women have lumpy breasts anyhow, but this is where we need to, I ask athletes to photo the bruising. I ask clinicians to photo the bruising. So we have an idea of the surface area, we have an idea of the region. I say, you need to know that, and down the track, if you have any biopsy, we need to be talking to radiologists and saying, I've previously had trauma here. And that's that whole, differential diagnosis between breast cancer and breast fat necrosis, because they look the same. And we want to save a 20-year-old from having a biopsy. So this is where there needs to be this medical referral, and then that's the doctor's problem now to solve and look at their relative risk factors of breast cancer, of what pathway we're going to go and are we going to monitor it. We're getting breast physicians to come in and being support for sports physicians, so they have a referral base to go to. We also have subspecialty specialists in GPs for breast. So we're creating pathways for sports physicians to refer on, because it's so broad what a sports physician has to manage, So I think I've managed to get it through in Australia because of the potential long-term consequences. And like I say to an athlete, if you just say you've got an implant and you get a breast injury and you don't report it, and then down the track that leaks, because you can have a slow leak of an implant, not a fast leak, and so they don't notice the deformity. It's not like it deflates straight away. I go, you won't have any injury report to go back to claim anything on any insurance because you never said it. You know what I mean? So that can have repercussions for the support you get for that injury as well. So, but look, it is challenging. It's challenging, and surveillance is really difficult. So I think there won't be time loss, and we will support them to keep playing, but we'd protect the breast until we felt it was back to normal, or they felt confident.
Thank you. I don't think there are any more questions online. Doesn't look like there are any more from the floor at the moment. So I think what we'll do is we'll wrap up there. So a massive thank you again from us, Deirdre, for coming over and giving us such amazing information and advice and where this is all going forward. So yeah, thank you from us again.
Thank you.
Final reminder just on the other events that are coming up. So I think next thing now is we've got an afternoon tea this afternoon at 2 o'clock. If there are any other questions that pop into your head through the day. And our final session today is about the innovation roadmap at 3:30. And then we've got Karen Jones's public lecture on the 24th of September if you want to sign up. So there are more immediate events and then other sporting fixtures and conference events that we've got coming up later too. So thank you all for attending. Obviously, this has been a very informative session today, a long one, but very, very rich, I think, which is great. So I think there have been a lot of really good questions. And yeah, please come back this afternoon if you've got any further questions for Deirdre or any of us in the Loughborough team as well. So thank you all for coming.
Thank you for listening to the podcast of Loughborough University's Institute of Advanced Studies. A quick reminder about how to stay connected. You can find us on Blue Sky, LinkedIn and Instagram, and you can also watch the presentations on YouTube. The podcast is available on all the major platforms. Please download, share, and most importantly, subscribe. See you next time.